hand it over to him midday to just have him go through it.
Okay, so we are live. Thank you. Wow, we apologize for the delay. We have had major tech issues here, and it's as Jasper reminded me that this is a reminder of how the year was. So of course, this is the last Let's Talk Face to Face, and it is going to having some challenges. So, but finally figured it out. We are here. Thank you for joining us at our Let's Talk Face to Face series. Today, we have a guest and a really great guest that we want to hear from. But before that, my name is Hanna Getachew-Kreusser, and I'm the Executive Director here at Face to Face Health and Counseling, working with young people between the ages of 11 and 24 in the medical clinic, mental health services, as well as programs for youth experiencing homelessness. Our topic today, as you can see, is HIV AIDS, a possible epidemic within the pandemic that we have going on right now. December is the month that we actually acknowledge and recognize the HIV AIDS and the what has happened in our community as a result of that. So we'll go right into it, our conversation. Jasper Gonzales is our guest today, our health educator here at Face to Face. Has done a lot of work in this area nationally, and now joined us here at Face to Face recently. Welcome, Jasper. So glad you're here, and so glad we are having this conversation live. Please introduce
Absolutely.
yourself and tell us a little bit about who you are.
Sure. So my name is Jasper Gonzales, and I use he, him pronouns. And I am a HIV educator and tester, meaning that I'll be going out into the community to offer HIV education as well as STD and HIV testing, and offering, rapid results as well. So getting your HIV status at the time of testing so that a person can really know at that point if they have HIV or not and what steps to take after that.
Wonderful. Thank you. So, as we said a little bit, and you can just explain kind of what even HIV is as you talk. But what is the reason that we're seeing as kind of the recent increase in kind of positive cases with HIV?
Sure. So when I was doing some research for the talk, the official statistics for 2020 aren't in yet for HIV new infections. It has just been a trend month by month to see the numbers coming in being a little elevated for in the Minnesota Department of Health website. And that could be due to a bunch of different things going on. Because we don't see a huge spike, it could be that testing is not where it normally is because we are in a pandemic. So we're not seeing as many people as we normally might, and we're not out at social gatherings like clubs or anything else to offer testing as well.
Mm-hmm.
So we'll have to see in the early months of 2021 what the CDC and Minnesota say about our HIV numbers. But I can imagine that we're going to see a slight elevation because of COVID and kind of the different behaviors it's kind of put us in so quickly that we're not used to.
And so, of course, we often talk about HIV and the stigma around it, right? Could you say a little bit about that also? Maybe perpetuating kind of some of the same issues.
Sure. So when it comes to HIV stigmatization and how we look at people living with HIV and how it, is introduced into our communities, the stigmatization of HIV in general has led to people not really talking about it or getting updated information. For example, I'm not sure about Minnesota schools yet, but there's not necessarily a lot of education when it comes to people living with HIV becoming undetectable through regular treatment with antiretroviral medication. and how when someone's viral load, how much of the HIV virus they have being suppressed down to an undetectable level means they can no longer spread HIV through having sex, even if it's without a condom or any other preventative measures. There's just not enough of the virus, exposed during sex to expose that partner to HIV and possibly have the partner become infected as well. So I think that's something that we need to talk about in the public because HIV isn't what it was when it was in the 80s and 90s, where you would watch movies like Philadelphia or just modern media at that time showing people with HIV getting really sick, that they live not very long after their infection. And, to avoid touching them at all costs, that's just not how it is now. People who take their antiretroviral drugs can live a long, healthy life because again, they suppress their viral load. And, if they're taking care of themselves, they're going to be about where we're at. It's a chronic disease at that point, no different than diabetes or high blood pressure. Take your meds and try to eat healthy and get a little bit of activity in your life. Oh,
Some of those prevention tips that have to be talked about more, and really just that what I'm hearing you say, and I think that this is kind of what we talk about, is how do we normalize in the topic itself and really talk about it openly so that it doesn't, transmission really doesn't get out of control. So then there's many we myth, right, kind of associated with HIV or other STIs that our community in our world, our youth and families need to talk about, right? And also those myths really contribute to the transmission in general. So just talk about that. You and I kind of have had some conversations about what are those kind of misunderstandings about, just the STIs in general, and what is the source of all that?
Absolutely. I think the first myth I really want to talk about has to do with health and sexuality education in our country and who is providing that education to, our kids. So the myth that I have heard, even from the lips of my own father, is that if we teach sex ed in schools, we are introducing sex to, youth, and they're just going to go and experiment purely because they sat in a sex ed class and they heard about, what sex is and the different body parts that women and men have and about orgasms. That's just not true. Like youth have sex. When I checked on the Guttmacher Institute of Sexual Health. Their last report was in 2017, and it showed just that 65% of youth, when they hit the age of 18, have had sex at least once. And it shows as young as 15, 20% of 15-year-olds have had sex or reported that they've had sex. So they're not necessarily like learning about it in class and trying it out. Kids naturally experiment because sex is a very human act. It's something that we all at some point may engage in. Our parents certainly engaged in sex or we wouldn't exist. So we really have to work on the stigma of, we don't talk about sex and we don't educate our children about sex because one, the school will do it, maybe, and or the internet exists and they can look that up because I feel it's important in a healthy relationship with your kids that you can talk about sex even from a young age. Just think about like consent, what the body parts are. It's okay to say no when someone touches you. It's okay to say yes, to young kids, like the really basic things that we all should really hear about before we even reach puberty. And then to talk to, our teenagers about healthy relationships, not just about sex, because sex is like the act, but like so much more is going into it. The relationship that those two people have, the communication between the two, before we even talk about preventing pregnancy, STDs, and HIV.
Great. Thank you. I think what I hear you talk about, and this is what we talk about here too, is that open conversations, right, about the things that we are uncomfortable about. So that could save lives, that saves a lot of stress and kind of unintended outcomes from not addressing things openly with each other, as well as adults to young people.
Absolutely. And that leads into another myth that we hear when it comes to HIV specifically, and part of why it's stigmatized and not as well known, is we think that HIV traditionally is like really a gay man's disease, that's only men who have sex with men who are really exposed to HIV. And while the numbers for men who have sex with men, or MSM populations, is the highest risk group, it's not the only group of people who are exposed. One of the things about that is when we look at HIV as just a gay man's disease, we're also saying that people who might be infected with HIV have to be gay. There are plenty of men who engage in sex with other men, whether through experimentation, through kind of a thing of the moment, or maybe that's, they're having the sex they can get while they are looking for the partner they want, who might be a cisgender woman or a transgender woman. But they don't see themselves as gay necessarily. And so we have to like separate out those two things so that men who do have sex with men, even if it's only once or twice, feel comfortable reporting to that to their doctor or to a health educator and tester. That way we can appropriately look at that risk for HIV, make sure that they're getting tested regularly while they're engaging in sex with other people, whether they're men or women, and offer them different preventive measures, whether it's different sex acts that don't involve the higher risk like anal penetration or vaginal penetration, whether it's offering and making sure they have access to condoms, offering them PrEP when it's needed, or directing them to get PEP if they feel they may have been exposed to HIV very recently.
Mhm.
So I think it's really important that we talk about how it's not just gay men who get HIV. They're heterosexual women, transgender women, transgender men who all get exposed. It's also a cultural aspect as well, because the two group of people that we see with the highest rates of HIV are men who, like Black men who have sex with men, and Latina men who have sex with men. And due to, cultural stigmatization of men who have sex with men, they may not be comfortable even getting tested or going to certain places to get tested for fear of being perceived of as being gay, and how that may affect their social status and their relationships with their family and friends.
Mhm.
So we really got to kind of start pulling apart all these different social and cultural fears and unknowns when it comes to sexuality, just to make sure that people aren't getting HIV. Because while it's very survivable, medication costs money, and there's also the anxiety of possibly having HIV and giving it to a partner, even when you do take your meds,
Mhm.
because that's just, when we care about someone, we would worry about giving them something they would have to live with forever.
Yeah. And I think the impact of all that behavior, and we've been talking about this, is on also women, right? Particularly
Absolutely.
African American women. Um,
Yeah, they are behind the communities of men who have sex with men. Women of color are the next largest group of people who are exposed to HIV. And I didn't mean to cut you off. Like,
yeah,
did you have something else
that's
that came to
that's
mind?
what I was gonna suggest that you talk about it for a bit.
Yeah,
Oh, yeah,
absolutely.
exactly.
So there are a lot of different reasons for that, whether it is again going back to stigmatization of men who have sex with men, but aren't necessarily just having sex with men. They may get exposed to HIV and bring that into new relationships. And if they're afraid to get tested, they may be exposing their cisgender female partner or their transgender female partners to HIV. And we also have to talk about how in even relationships that may be abusive or don't have good communication or are not monogamous, strictly speaking, how someone else can leave that relationship, have a more risky sexual encounter where maybe they're not thinking to use protection and come back into that original relationship and accidentally transmit it to their partner. And then there's really the thing that we don't talk about a lot, which is also sex work, which is there are men and women who engage in sex work, whether it is because they want some money on the side or they really enjoy that line of work, or whether it's for survival, just like they need to have sex with other people to get their material needs met, whether that's money, housing, food. And in that line of work, there's sometimes due to a completely separate stigma, you're not necessarily getting the best healthcare. There are no benefits for doing sex work. You may be afraid to get tested. You may be afraid to say no to someone if you say, we have to use a condom. And that person's like, I don't want to use a condom. And you might be afraid to lose that source of income. So you're like, okay, you know, and that's not even for sex work. That could just be in a relationship.
Yeah.
Like you meet someone to have sex with and they say no to condoms. And you're like, well, I do kind of want to have sex right now. And they say no. And that could be a way to get
Yeah.
HIV, unfortunately.
Right. So I think in just really kind of bringing it kind of also closer to our young people and their families, what what are you saying or talking about, like the things that we can do to reduce the spread of HIV, really? And then of course, like there's kind of two parts to this question.
Yeah.
What is face to face doing currently to in this area so that we can actually be a resource for young people and families as they navigate this world of the possible HIV AIDS or exposure, right? So
Sure.
what do you what are your wise um, thoughts here?
So, as you can tell, I'm really passionate on the subject, and I have been doing this work for several years. The biggest thing that we could start doing, even individually as parents, as friends, loved ones, is just to talk more openly about sex. And again, remove that stigma of even just talking about sex, not keeping it behind closed doors or being ashamed to talk about sex with your child. By doing that, you can just, one, make it more normal for that child to talk
Mhm,
about sex as they grow up and they go to the doctor's office or they go to a clinic. So they're not going to be as embarrassed to talk about things regarding their sexuality.
yeah.
As well as, it does create a relationship of trust between you and your child just to be openly talking about that kind of thing. They feel that they can come to you and ask those questions, and also just to reduce HIV specifically, just really openly looking at the information and getting updated understanding of HIV. So getting that health education like someone like me at face-to-face offers, and making sure we're talking about getting tested on a regular basis, whether that's at least once or twice a year, if not every 3 months, just come in, get an HIV test, get checked for STDs, just to see what your status is and to ask partners, like encourage everyone, youth, adults, just ask your partners about their STD and HIV status. And before having sex with them, even if it's a hookup, talk about your status, talk about possibly getting tested or getting tested together, going to the same clinic and seeing two different, testers to get your results. That's just taking care of yourself. That's self-care, in a way. Um, as well as talking about LGBTQ sexualities and kind of,
Mhm,
even if it's not something you necessarily agree with as an adult, just being aware that they exist
mhm,
and being able to talk with youth who express that to you without shaming them or making them feel afraid, because LGBT youth are at a higher risk for mental health concerns, homelessness, and other things that may lead them to have riskier health choices, whether that's exposure to using injection drugs, having survival sex or just having sex with multiple partners, or even just having sex that isn't protected. Uh, that can all happen to the youth that we see. And that's why I think face-to-face is great, because not only do we work with homeless youth, we're offering them not just a safe place to come and hang out, but a safe place to get tested and to learn this information, so that they can better protect themselves. And of course, at face-to-face, we offer free condoms, free lube, dental dams, as well as free testing, so that people can get their results. And also we talk about PrEP. I think that's the one thing I didn't really get into a lot in this talk, and we could definitely do a separate one on PrEP. But PrEP just stands for pre-exposure prophylactic. And what PrEP is a pill that a person takes every day. And once you've taken PrEP for about a month every day, you now are protected from HIV infection should you get exposed, whether it's an accidental exposure or if you're using injection drugs, for example, and the person you're shooting with and sharing needles with has HIV, or their blood somehow may be introduced to you. It's great. I think more people should be using it. It really is for everyone. And the face-to-face offers PrEP here as well. So, come in for testing. And if you feel that you're at a higher risk for HIV infection, ask us about PrEP and we can start getting you connected to it.
That's great. That's wonderful. I think what I'm also hearing from this, and really it's true, is there is no judgment. And I think that's what we talked about. There is no judgment for people's choices, right? So I think it's really important for us to say that, and also it's a myth when we say talking about things perpetuates the behavior, and we've seen that the research and studies show that. I think having a safe space for young people and families to talk about these things can prevent a whole lot of cost to human lives, as well as society and social services. So that's the kind of the summary of what we're talking about. Any last parting thought that you want to share, Jasper?
Sure. Everyone watching this, maybe go out in the next couple months as COVID kind of dies down. Go get tested, whether it's at face-to-face or another clinic or asking your doctor. Get tested for HIV, get tested for STIs, and also have a conversation with someone that is close to you about, sexuality and healthy relationships. You might be surprised of what you learn, and that curiosity and openness to not judge someone else for their lifestyles or their choices, or the situations that they're just in at this moment, um, can really help other people feel safer and feel better prepared to make choices that put them at less risk.
Thank you. Well said. Thank you, Jasper. Would love to talk some more about this some other time, but I think it's just a really glimpse of what we do in this area, what we haven't normally kind of talked about. It's been a while. So thank you for joining me here in this conversation. And I think hopefully that, your business card, that you thought about flashing could actually, right. So that is how you get hold of one of the health educators anyway at face-to-face. And Jasper, thank you very much. Thanks for joining us. And we will see you next month.